Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health and well-being. This is our 29th episode. In this episode, we are going to discuss about obsessive compulsive disorder, also known as OCD in an abbreviated form. Obsession and compulsion are very common English words. Obsession means a repeated thought or persistent ideas of preoccupation, intense preoccupation about a subject, about an activity, about an object of interest. It could be anything. It could be normal also. Compulsion is a desire, an urge to do something. It's more of an activity, compulsion. But when we talk about obsession and compulsion in a psychiatric parlance or in a psychological way, we are talking about a disorder. We are talking about a disorder which is not very uncommon. People do suffer from this particular disorder. So let us see what is the disorder. Let me give you some explanation about the disorder, how it presents and what are the signs and symptoms. In an obsessive compulsive disorder, when we are talking about obsession, we are talking about an idea or a thought which intrudes into one's consciousness repeatedly and persistently. It comes back and again, and it intrudes into one's consciousness. That means the person gets the thought repeatedly, persistently. That is the first aspect of the disorder, the thought, the obsession. The next part is that thought makes him feel very, very anxious. So that person who gets this thought feels very, very anxious because he doesn't want that thought. He knows his thought is a nonsensical thought. What an idiotic thought I'm getting. How can I get this thought? I don't want this thought, but the thought will come back to him again and again. And the thought will make him do certain acts. That's where the compulsion comes in. So obsessive thought, repeated, persistent, intrusive thought into one's consciousness. The thought which that person does not want, wants to stop it, wants to chase it away, but in spite of that, it will come back again and again, induce a lot of anxiety till he does some act or some activity. That is the compulsive part. So obsession is the thought, compulsion is an act. This is a kind of a definition of obsessive compulsive disorder. I'll give an example so that you can understand the definition more clearly. Suppose I get a thought. So I've set up all the camera, everything, and I'm shooting for this episode. Just before I start this shot, I get a thought which tells me, Soundarajan, before you start this program, before start shooting this program, you will have to tap 3 times on any wooden object. 1, 2, 3. The thought will come back again and again. I know, why should I do that? I might question, why should I do that? But thought will also give you an idea, give you the thought that if you don't do that, something bad will happen to you. If you're going to dry out, you're going to get involved in an accident or something. Something bad is going to happen. That induces a lot of anxiety. The thoughts are like, I'm getting this thought. The thoughts tell me if I don't tap 3 times in a wooden object, I'm going to meet with something dastardly accident or something bad is going to happen to me. If I don't do that, the thought is going to persist and that's going to induce anxiety in me. I may start thinking that what if I get into accident? What if something bad happens to me? And that anxiety, that pressure makes the person to do the act. So 3 times. The moment he taps 3 times, the anxiety comes down. The thoughts might go away for a short period of time. The thought might come back again. The duration of that relief could be hours, or minutes or hours or even days sometime. But mostly it comes back immediately, or it triggered by some happenings around him. For example, if I have a thought about dirt and I go to some new place and I touch the doorknob, then the thought will come and tell me, you have touched that knob that was handled by many other people, there is going to be a lot of germ there, and you're going to be infected and you will get in a lot of problem. You might even die because of infection. So what you need to do is wash your hands. Wash it 3 times or 5 times. There will be a magical number. 3 times or 5 times or 7 times, or it could go higher. This can happen more frequently in a day. It can happen once in few hours, or it can happen hourly, it can happen repeatedly, depending on the situation. That is the obsessive compulsive disorder. Obsession is a thought, a repeated thought. Compulsion is an act. It can take many forms. Before we go on to the forms of this obsession, let me talk about something normal. Can obsession be normal? What are your thoughts? Yes, it could be normal. We could see that more in children. Obsessive play or touchwood is an obsessive phenomenon. So you say something and then say touchwood, it goes well. What is that? There is a thought which tells you if you touch the wood, everything will be fine. So there is a magical aspect to that, isn't it? If I touch 3 times or tap 3 times, it's not going to happen. That's a magic. And it is also undoing. If I tap 3 times, that what is going to happen is not going to happen. So these are the 2 concepts which is in the OCD or obsessive compulsive disorder. Magical thinking and undoing. Magical thing is going to happen suddenly. Once I do that, everything will be clear. I'm fine. That is magical thinking. And if I do that, that will not happen. That is undoing the act which is going to happen. Undoing something bad which is going to happen. That is the phenomenon of obsessive compulsive disorder. When we come to the normalcy, normal play, now in the olden days we used to have black and white squares now on the floor, tiles. Do you remember? Some of you might recall. Now as a child, we might step on only in the black or white. We'll have our own preference. That is a kind of an obsessive phenomenon. And if the person is a very religious person, and if he walks in front of a temple, mosque or a church, automatically he will do that, put a cross. That is again an act which he will do it automatically. Sometime you might think, if I don't do it, something bad will happen. That's a kind of an obsessive phenomenon. So there are many ways in a normal life we do have obsessive phenomenon built into our life. Now, I used one particular pen in an examination and I scored very well. I linked that. Then I will say, whenever I go to the exam, I should take that pen. By chance, if I misplace that pen, I'm not getting anywhere, I'm searching for it, my anxiety mounts. Oh, I'll have to go to the exam around 10 o'clock. I'm not getting this pen. So that is a kind of an obsessive phenomenon. So obsession can be to a certain extent normal phenomenon, but it interrupts your life. When it becomes distressful, when you don't want those thoughts, it comes back again and again and induces a lot of anxiety, very painful anxiety, then it becomes a disorder. In fact, Freud called religion as an obsessive phenomenon. He said there is a magical thinking there is undoing there. So there are a few thoughts about obsession as a phenomenon in a normal individual and abnormal individual. So in an abnormal individual, it will be very pathological, it will be very intrusive, persistent and distressing. What we call in a psychological term, we call it ego dystonic. It hurts. It hurts our ego. I mean, I feel very sad or anxious and I don't want this thought. It comes back again and again. I'll feel very helpless. So that is the obsessive compulsive disorder. Let me give you some kind of a prevalence and other data. Now, some of the research point out that 1 to 2% of the population could be suffering from obsessive compulsive disorder. And it's equally seen in both men and women. So there is no kind of a differentiation between men and women. It can equally affect men and women. And usually starts in much younger age, around late teenage or young adult, probably 18 to 20 years. We have also seen obsessive phenomenon, OCD in children. I remember seeing a 3 or 4 year old child with obsessive behavior. The obsessive behavior manifests that the child will come and ask the mother, "Are you my mother?" Repeatedly, the child will ask. Nobody told the child that that mother is not your mother. But the child gets that thought somewhere, and then he repeatedly asks. Mother will have to reassure. Child will go and play for about an hour or two, then come back again, repeatedly ask. We have seen that in children also. But more commonly, we see in late adolescent and early adult. But usually it goes unnoticed. They come to the treatment average in about 5 to 10 years after the onset of the illness. Because initially they might think it is not abnormal. They might think it is not a mental illness. They may not know it is a mental illness. Now, due to social media and all the other developments, people have access to information. They can learn about OCD in a fraction of a second, in a click of a button. But I'm talking about early days now, 10 years, 20 years ago, they never had any idea. So they suffer without knowing they're suffering from a mental illness, and there is a treatment. And many a time they do it without others noticing it. They do it secretly. I'll give an example. I talked about dirt and the washing ritual. So suppose I have the fear about contamination. I fear that if I touch anything in a public place, there'll be germs, I'll be infected. So thought will be, you have touched the doorknob in a clinic, and many patients would have touched that germ is going to come to you and you're going to get infected. So what you need to do is wash 3 times. So I'll go and wash 3 times. Nobody notices. Nobody will notice it's abnormal behavior. It could be passed on as a normal behavior. But it will not stop with one episode. It will come back again and again. And the number of times you wash the hand will increase. It will go to 7 or 11 or 15 or even 20, 100 times. Then it will come back more often. Now, whenever I touch anything, even at home, when I touch something, the germ thoughts will come. Then I immediately go and wash. Then my close family will notice there's something wrong. Why is going and washing so many times? They might ask, why are you doing that? I might give some kind of an excuse, and then, so when it reaches a particular stage, which becomes very disabling, suppose I want to leave immediately for an appointment, but I get this thought, you need to wash, I go and wash, I get delayed. So obsessive symptoms can delay the appointments, delay your commitments. Like that, there are many ways, many ramifications in your day-to-day life. So that is obsessive compulsive disorder. Now, coming to the forms of obsession, there are different ways obsession can manifest. One is thought. That's what I've talked about, thought level. The obsession comes repeatedly. Then the thought can also be a doubt. I said a child wanted to know, are you my mother? That was a doubt, obsessive doubt. This obsession can manifest, doubt can manifest in any way. Obsessive doubt can be, I locked the door, I walk a few paces away and then come back and think, have I locked properly? Doubt. Then I go lock it again. Again. There could be a magical number in that. Obsessive fear. The people can start fearing for many things. Now the fear will be irrational, out of proportion. For example, fear of germs. That could be obsessive fear that because there are germs in everywhere, I'm going to be infected. And obsessive rumination. Rumination is a continuous loop of thoughts which comes on and goes on and goes on and goes on. That can be an obsessive rumination. And obsessive impulses. People can be very fear of impulses. For example, I see a sharp object. I see a knife, kitchen knife on my dining table. Then my thought will tell me, you might pick up that knife and stab someone. So you might get that impulse. Or I feel I might get that impulse to stab someone. He will not do it, but thought will tell him, you might do it. Or he might fear that impulse might come. Then for that he has to do something. He has to hide the knife or do some other ritual to ward off the thought. So these are different manifestations of obsession. There are also different types of obsessions. One is aggressive obsessive thoughts. Aggressive thoughts is, am I going to hurt someone? Or thought might say, so you're looking at that person, you're feeling like you're going to hit him. You're going to beat him up. That kind of aggressive thought will come. the person will fear that I might do something. To undo that, he'll have an idea that I should do certain activity. So I should wash my hands, or I should go around 3 times and somewhere something. So that kind of a compulsion will come in. So it can be aggressive thought. It could be a thought about contamination, as I already said about germs, and sexual obsession. Now it could be quite distressing. Now patient might have very abnormal sexual thoughts, repeated thoughts coming into his mind, and also the thought telling him you'll have to do this ritual. If you do that, the thoughts will go away. So it could be very weird sexual thoughts, or it could very impulsive sexual thoughts. All those thoughts could be very distressing for the person, and he has to do a ritual to ward off the thought, but thought will come back again and again. And hoarding is also another phenomenon we see in obsessive compulsive disorder. Now, we all buy things, electronic things, or the makeup things, or whatever it is. We buy things to a certain limit. We buy it for our needs. But when the person has a hoarding as a phenomenon, as an obsessive phenomenon, they accumulate things, many things. Even if they don't use it, they accumulate it. Their house will be full, loaded with many things. I can recall a patient whom I visited at home. This is about probably 10 years ago in the UK. Now, we know, this person suffers from hoarding disorder, obsessive compulsive disorder manifesting as a hoarding. And I was told that he can't come out, we need to visit him. So he's refusing to come out, but he doesn't mind me going and seeing him at home. So I went to his house. This person has a hoarding as a predominant symptom. And this person buys electronic goods. He's interested in buying electronic goods. So he buys lots of electronic goods and keeps it at home. That is the kind of a introduction given to me. So I go to his house and knock on the door, open the door. On the corridor leading on to the lounge, on both the sides of the wall, ceiling to the floor, there are a number of boxes. Very interesting electronic equipment, like hair dryer, tape recorder, you name it, it is there. So I walk down, he's in the lounge, whole of lounge, whole wall is covered, ceiling to floor with the boxes again. Boxes containing whatever he bought. He had 3 bedrooms, all 3 bedrooms full of boxes. You can't walk straight and freely. I'll have to turn around and walk slowly like this. I can't walk like this, I'll have to walk like this. So much of stacking of the boxes with the equipment what he bought. And when I asked him, have you seen all these equipment? He said, some of them I didn't even open it. That is an obsession. That is obsession of collecting things, hoarding things. That's a kind of obsession. And religious obsessions can be there. And one of the religious obsession is when you go to a place of worship, the person might get very obnoxious thought, blasphemous thoughts. That will be very distressing, because he's a very religious person. He goes to a temple or a mosque or a church with an idea to pray. When he goes, he stands in front of the altar or wherever he goes, he gets these thoughts, very blasphemous, horrendous thoughts. It comes to him moment he enters these religious places, and it makes him very distressed, and that leads to compulsive behavior. The thought also tells him, if you do this, then the thoughts will go away. So religious obsessions can also manifest. And the obsession about symmetry, everything should be in order. They'll keep everything in order. You're visiting him, you take some pen and write and keep it somewhere else, they will slowly come and keep it back in the same place. They want everything in order. Orderliness is very important. They can neglect everything in their life, but they will be obsessed with orderliness, exactness or orderliness or symmetry. And somatic delusion, somatic obsession. Somatic obsession is obsession about the body, their own body. They might think that, they might have an idea that their nose is not all right. It is deviated to one side. We call this as a dysmorphophobia, where they are distressed about their own body parts or how they look. This is again somatic obsessions, and this can induce a lot of anxiety, and they might even believe in that and go do doctor shopping. They might even subject themselves to any kind of a surgery, any kind of investigation to correct. Doctors might tell them, like, your nose is perfect, there's nothing. I'll take a photograph and show you. This is not. I'll show you others' photograph. Now you look at any of the ads. Compared to that, your nose is as normal as anybody else. But he will not be convinced. But obsession will be that my nose is deviated. So those are different types of obsession. Then we'll come to the compulsion. As I said, compulsion is an act to ward off something bad is going to happen. So compulsion follows obsession. Obsession is thought, compulsion is a behavior or an act. So there are a number of ways the obsession can manifest in compulsion. One is cleaning or washing rituals. I have given you example. They repeatedly wash. They have to wash a number of times. There will be a magical number they have. That number might change over a period of time. And duration of wash, frequency of washing will increase. I remember seeing a lady. Her obsession is dirt or contamination of bed sheets and pillow covers and bed. So every day she has to wash all the pillow covers, all the bed sheet, everything where they sleep on. That obsession is very strong. She can't go to sleep without that. She has to wash every day. If it is a rainy day, there is no dryer in the home, even then they'll have to wash. Husband told me there are times where I had to sleep on a wet bed sheets or use a bed sheet because we didn't try it. But she can't sleep without washing. So that's a kind of a disability it can produce. That's a kind of a disruption in life it can produce. So that is washing. Checking compulsion. Checking compulsion is you check repeatedly. One common thing is you lock the door as you leave the home and then come back and check. Once it is okay, you might come back and check 3 or 4 times or 5 times, even more than that. And you'll pull the lock and see whether it's properly locked. So that is checking. Or they can also check many other ways, not only lock. The housewife can have a doubt about whether I switched off the gas. I was cooking, whether I switched off, they'll go out, they'll have gone about 5-minute drive, they'll have the doubt and come back. And that is checking. They repeatedly check. Go out and come back, and go out and come back, check. Repeat things. Now repeatedly doing things. Now repeatedly saying few things. Now they might use one particular word repeatedly as they talk, or they can repeat an activity or repeat a gesture. All those things can be an obsession. And counting compulsion. They can count things. Now everything they'll count. And when they see a car approaching, they'll count the number plate. Or they'll look at the number plate and add it up and come to a number. They'll have some kind of a number phenomenon there. So counting can be a compulsion. And ordering, as I said, knows the symmetry and the ordering. So they'll have to keep everything in order. And if somebody disturbs that, they'll become very, very, very disturbed. They might become very verbally aggressive also. Don't do that. They'll be quite aggressive with the family members because they disrupted the orderliness. And hoarding and collecting, I mentioned that, I'll give an example. And mental rituals, they may not manifest, but they'll have a mental ritual in their mind. They might, within themselves, they say, before I leave my house, I need to say this 5 times or 7 times. Or I need to do this mentally. So that can lead to what we call obsessive slowness. So these people delay things because of the obsession which is going on. They can't carry on immediately. Suppose a person has that obsessive thoughts, repeated thoughts or mental rituals, and he has to complete the ritual before he leaves the house. So husband and wife, they are leaving for shopping or somewhere, going for a party. Wife got ready, husband, both of them are ready, he is about to leave, but wife goes out and waits for him. He will not go out because he'll have a ritual in his mind. He has to do certain things before he leaves. He'll have to check few things or do something or repeat certain words, then only he can step out of the house. So that can delay the whole thing. So it can lead to a lot of problems. So these are all some of the aspects of obsessive compulsive disorder. And it can be quite distressing disorder, and it can also be very, very disruptive. Now it can affect the normal life, it can affect the work also. For example, I am a cashier in a bank. And one of my activities is counting notes and give them. So somebody comes and asks me certain notes in a certain denomination. I'll have to count and then give it. Suppose I have an obsession about whether I have counted rightly or not. Oh, I'm going to give 1,000 pounds in a smaller denomination. I counted. Before I give, I get an idea. Did I do it correctly? Have I missed something? Have I added, instead of 10, am I giving 12? So that obsession you will count again and again. Then whole work will be affected. So that way, obsessive compulsive disorder can be very distressing. It can also be very disruptive in a severe form. And many a time we have seen obsessive compulsive disorder with anxiety features. It used to be classified under anxiety disorder. That has slightly changed now. But anxiety can be a predominant feature in an obsessive compulsive disorder, especially when they resist the thoughts. Then anxiety can mount. So some of the research say that about 25% of the obsessive compulsive disorder patient can have social phobia also. They might fear to go out. They might fear social situations. They might fear that something I'm going to present something weirdly, or I'll make a fool of myself. Some kind of fear might be there. So that is about 20 to 25%. And they also reported that about 50 to 60, about 60% of the persons with OCD or obsessive compulsive disorder can also develop depressive symptoms. They can also go through depression. These are all some of the accompanying disorders. And obsession by symptom alone can be a part of many other disorders. For example, psychotic disorders, schizophrenia can have obsession as a symptom, but we don't call that as obsessive compulsive neurosis or obsessive compulsive disorder. They are part of the other problem. So these are all some of the features of obsessive compulsive disorder. Next question is, what is the treatment? How do we treat? In fact, I spent about 45 years in psychiatry. I remember early days of my psychiatric experience. We used to struggle with patients with obsessive compulsive disorder. We didn't have a very effective medication those days. I'm talking about 20, 30 years ago. We didn't have very effective medication. Not many choices were there those days. When we get obsessive compulsive disorder, we used to struggle with them because they come back with the same symptom again and again, sometimes worsening. In 1980s, a new group of medications were introduced. They were called SSRI. So this SSRI group of medication quite effective in managing obsessive symptoms, obsessive compulsive symptoms. So since 1980s, we started using those medications. There are 3 or 4 medications which are quite effective in obsessive compulsive disorder. In certain situations, certain cases, they can completely get rid of all the symptoms. In certain situations, certain cases, it will control the symptoms such a way that it can lead a normal life. And their distress can be reduced dramatically, and they'll be able to function much better. So medication is one choice for treating obsessive compulsive disorder. Usually in a mental health, in a psychiatry, most of the time we combine medication and psychological therapies because they are equally effective. In a combination, they are more effective. So there are a number of psychological therapies available. Those days, we used to have a therapy called stop-start therapy. That therapy, we don't use it now. I'm just giving you a matter of interest. So that therapy is not very commonly used now. That therapy is, the moment you get a thought, you loudly say stop and try to stop it. But later on, we have a couple of very effective therapies. One is CBT, cognitive behavior therapy. I mentioned that in my previous episodes. Cognitive behavior therapy is one of the very effective treatment, psychological treatment, or what we call talking therapy. And it is effective in many of the conditions: anxiety, depression, insomnia, and chronic pain. Now, many of the conditions we use CBT. There is another therapy called ERP, exposure response prevention. The ERP is another very effective treatment, and it is based on the CBT concept now. So it's a variant of CBT. We can say it is a variant of CBT. Now, where the person is exposed to a situation where the obsession thought will come, and the response, what he wants to do, is prevented. So when that is prevented, and also that is done with a systematic way, the therapist will be there and then they'll try to manage that. So I'll give you an example. Suppose I have a fear of contamination when I go to any public place, when I go to my office or a hospital or a train or a bus. When I touch something which is handled by public, I get an intense fear. I feel that my hands are infected with germs and I'm going to be infected, I'm going to die. That's anxiety I could develop. So when in that kind of a situation, in exposure, a therapist might take the person to a public place and ask them to open the door. I'm giving a very simple example. Open the door. So it's a public place. Many people would have used that door. The moment he touches the door, he gets a thought. Then therapist will try to manage the situation, try to avoid the response he is going to give. So immediately he needs to go and wash. Therapist might say, don't do that. I'm going to be with you, we'll manage that anxiety. So go through that phase of anxiety. Then therapist will manage that anxiety, giving some techniques to manage the anxiety, and this is done repeatedly over in a systematic way. So that way, patient learns to postpone the urge or mitigate the urge of doing something immediately, thereby learning to manage the anxiety which is provoked by the obsessive thought. This is one of the effective treatment. Many research evidence is there, both CBT and the ERP are more effective. So in this episode, we talked about obsessive compulsive disorder and its manifestation, and the symptoms, and the types of obsession and compulsion, and the treatment. In the next episode, we will discuss about some of the psychotic disorders. There are a few psychotic disorders, for example, schizophrenia, paranoid psychosis, puerperal psychosis, manic psychosis. All these are psychotic disorders, different types. We will discuss about that. As a prelude to the psychotic disorders, I am going to explain about what is psychosis. So in next episode, we will discuss about psychosis as a phenomenon, as a disorder. Then we'll take on individual psychotic disorder. Thank you for being with us and watching us. Do share this program with others if you think it's going to help them. And do comment, and if you like, do tell us you like the program. Thank you. Bye. See you in our next program.